Presentation 4. This training program is based on the RBT task list and is designed to meet the 40-hour training requirement for the RBT credential. This is offered separate and independent of the VACB. Also, go Fantastic Four, right? Rapport and instructional control. These are two different kinds of relationships that you will want to foster with your patients. So what are those? Rapport. A successful technician will begin with building rapport. Rapport means a harmonious or sympathetic relationship. You have a relationship built on trust, friendship, and fun. I do want to make a caveat or kind of a soapboxy thing right here, where you cannot go in there expecting to just be their person's friend. Okay, that has to develop over time. Because if you go in wanting to be someone's friend, you may let them get away with stuff they shouldn't. Remember, you are an interventionist first as an RBT. You have to implement the interventions as prescribed in the skill acquisition plans and the behavior plans. But if over time you are predictable and consistent with giving reinforcement, you will develop a friendship, or at least, at the very least, a relationship that's based on trust, friendship, and fun. Your goal is to make yourself a signal for reinforcement. Associate yourself with things the child likes to do. Be that person who gives the individual their favorite toy, activity, or helps prepare their favorite snack. Be true to your word. Don't offer that person anything you can't give them. And always give that person what you told them you would. Remember, you want to build a trust relationship up. And I'm not just saying that to sound hokey pokey. Okay, you want to be a signal for reinforcement. You want to be consistent. If you think about iPads and video games, the reason why I get a lot of parents who will ask me, well, they can play with that thing all day and be fine, but they won't take instruction from anyone. If you think about why that might be, it's because iPads, you press a button, something happens. They're consistent. They're predictable. That's how we want to be. We want to be consistent and predictable, while also providing a lot of fun and routine for that person. So again, it is important to do this. Make yourself a signal for reinforcement. Make yourself a signal for communication and approach. Be ready to deliver attention to the child for any communication approach or they attempt to make. But also remember to respect that child's personal space, privacy, and independence. Remember, we are working with children with autism. They are children first. They will have some personal space issues. They may want some privacy. They want to act independently. Okay, they want to have fun as well. And remember, kids aren't perfect. Sometimes they're just going to throw tantrums or have a bad day. But make yourself a signal for communication and approach. Remember, you are providing an enriched environment. This means that communication attempts that no one else may be able to know about, or may know that it is a communication attempt, it is one of your jobs to get to know what those are. Basically the little signals or the little ticks that a person might have. And be ready to honor those. Instructional control. So, having established a relationship in which a child will comply with given instruction, think of it as a positive working relationship. Rapport and instructional control are not mutually exclusive. But if you have established good rapport, building instructional control will be easier. One of the first patients I ever worked with, I could get him to do things, but it was obvious he was not having fun. And he didn't really like to approach me when I was there. So I took a couple days, didn't really do any programs, but just played with the kid. Got to have got to be fun with him, drew pictures for him. Once I got that rapport, I was able to get even more instructional control, and sessions went a lot faster as far as how fun they were and how much program we actually were able to get done. So it is very important. Even though they are different, they help each other. So my advice to you is to establish good rapport and then develop an instructional control relationship. A good way to do that is to be predictable. When the person asks for something, either give it to them or provide a way for them to wait and then get it. This is something that's very difficult to teach in any place but the field. Even defining rapport can be difficult. But if you can get that person to want to approach you because you've paired yourself with reinforcers, you're well on your way. So instructional control. You've already established a healthy rapport and the child follows your lead. Very important for working with our individual patients. So let's now discuss manipulating antecedents. This can be a very powerful tool. D03 of the RBT task list says to implement interventions based on modifications of antecedents such as motivating or establishing operations and discriminative stimuli. Remember, antecedents are what occurs before the behavior. So we're going to be talking about things right now in the antecedent realm before the behavior occurs or before the response occurs. Setting up antecedents. Desired behavior can be encouraged by manipulating antecedent conditions. Properly preparing for the program or planning for the program. Quote-unquote sabotage situations to encourage communication. For example, I will kind of steal or kind of take a person's toy when they're not looking or what they want, so they have to ask me for it. I'll never take it right out of their hands most of the time, but I'll try to get access to it. Or I'll set up favorite things that they have to ask me for. Another way I'll do this is I'll put their favorite stuff in like a bin that they have to ask me to open. Basically anything that's going to encourage communication. Remember, we can use deprivation to our advantage. Ask the parent or ask the guardian what they haven't had that day. Maybe they haven't had their favorite snack yet. Using antecedents to encourage desired behaviors. Planning for program. It is your responsibility as an RBT to plan ahead so that child can have a successful session and be able to receive immediate reinforcement. If you find yourself fumbling through papers or trying to find all the stimuli that you need or trying to get the reinforcers organized, that's all time that you're not attending to the patient. So make sure to take a few minutes before each session to set your programs up. This will make not only programming easier, it will provide less time for the person to engage in problematic behavior and more time for you to attend to any kind of communication attempts or good behavior. It will make you seem less flustered, and it will allow you to attend to the child more. Stay organized. Have materials ready and tidy. Know when and where you're going to run those programs. And again, this isn't all going to take place in one day for you. This will take a little bit of doing, but you will get there. When running programs, have as few stimuli in the environment as possible. Try to have it maybe like in a box beside you or something. Just so that way you're not reaching for things, grabbing things, trying to look for it. Have work areas prepared ahead of time The more lessons you run, the better. Remember, we're trying to utilize our time effectively, and we're trying to catch these individuals up. They're behind. They have deficits. So it is imperative that we have several trials going on throughout the day and run programs throughout. Read the goal carefully. What exactly does the patient need to do? What would a correct response look like? What about an incorrect? What is your SD? An SD is another name for an instruction. What prompts will you use if needed? Make sure the data sheet is ready and positioned to take immediate data. Make sure to have the reinforcement and have it prepared to give immediately. Before beginning any program, you should have reinforcements ready. A few ways to find reinforcement in the moment include reinforcement sampling and a preference assessment. We're trying to find out what the individual wants to work for. Reinforcement sampling. The first one is the free sample. We let the individual have access to the reinforcer. Or we give them a piece of like the food or whatever. Basically, we give them exposure to it. We ask ourselves, do they interact with the item? Do they really want to seem like they want it? Then awesome, you can use that for reinforcement. And conversely, if they don't really seem, or they seem disinterested, it's probably something that you can't use as reinforcement. Remember, reinforcement is only determined by the impact on behavior. So a person can actually like an item, but they may not work for it. So you want to make sure they actually reaching for it, that they really seem to really want it. Give the individual a few transition warnings, like my turn, okay, time's up. Something that way you're not just taking something from their hand. Don't let that individual get satiated. Remember, satiated is kind of like the opposite of deprivation. Satiation means you've had it too much. So if you're letting the person try, like, say, a new snack, only give them a little piece. We want to use deprivation to our advantage. Then we're going to give another type of transition warning, something like my turn, and then we can use it as reinforcement. The point being in reinforcement sampling is we're going to let the individual try it a little bit and to see if they actually want to work for it. A preference assessment, on the other hand, is based in choice. Choice is very powerful, even for adults. Several studies have shown that people will work for choices. Choice can be empowering. It's a great thing to do. And a preference assessment is a version of that. We want to frequently give our patient choices of what to work for. We may offer 2 or 3 items. Do you want the blue jelly bean or the red jelly bean? And for all you younger people out there, that's a picture of Morpheus from The Matrix. It was a movie from 1999 where he offered Neo the blue or red pill. At least I'm thinking that's what it was. But basically in a preference assessment, we're giving it what's called a forced choice. Do you want this or this? Based on items that we know the person likes. Usually only 2 to 3 choices are offered at a time. You may have to simplify this assessment. Just use the labels. Do you want the ball or the car? Do you want the $100 bill or the $100 in quarters? Wouldn't that be nice? We're going to allow the child and individual to make the choice by reaching for or touching or looking at the item. When they make their choice, label the item. Car, money, whatever. We may need to use visual aids such as a choice board or a picture exchange communication system. We'll talk about those in a little bit. Now eventually you will get to know that person so well, sometimes you don't have to focus so much on these preference assessments. You kind of know what they want to work for. But if you find a person getting squirrely or not wanting to work or a little indifferent to what you have, offer these forced choices. Forced choices can be very, like I said, can be very powerful. Instill teaching or sabotage. Setting up activities so that your child will need to communicate with you or another person to gain reinforcement. For instance, putting items out of reach so the child must ask for it. Also, try to take advantage of random teaching opportunities that come out throughout the session. Remember, you are providing an enriched environment. Use learning opportunities to your advantage. All these individuals that you'll be working with have deficits in many areas, and we are trying to catch them up to their peers, or to make them as independent as possible. This means to not let any learning opportunity go to waste. Let's brainstorm strategies for sabotaging our activity to encourage communication. What specific antecedent manipulations would you make? And remember, antecedent manipulation is something before the behavior, so before the response. I might put the paintbrushes out of reach so they have to ask for each paintbrush. I may put each specific color out of reach so they have to ask for each color, or point for each color. There are several things that you could do. The point is you want to do it before you actually start the project, so that way you're prepared. So try to remember what the 4 properties of effective reinforcement: deprivation, immediacy, size, and contingent. That's a little pop quiz for all of you playing at home. So, deprivation, what does it mean again? The reinforcer is more effective and more desirable. The patient hasn't had it in a while or hasn't had enough to be satiated. So if I haven't had pizza in 3 weeks, trust me, I'm in a deprivation state. But if I had it for lunch a couple hours ago, well, it's pizza, I'm probably still in deprivation state. Just kidding. Probably means I'm not. Probably means I'm satiated. So again, deprivation. The reinforcer is more effective and more desirable. The patient hasn't had it in a while or hasn't had enough to be satiated. So we're going to use deprivation to our advantage. Set known preferred items or activities aside as reinforcement for program only. Save certain toys or activities for more difficult goals. And there is a name for this. That is remember, DISC is referring to reinforcement, which itself is a consequence, right? So why are we talking about this in the antecedent realm? Well, because we have to set up these deprivation states. We have to make sure the items are separate, in a deprivation, which is in the antecedent realm before the actual program. And the name for this is a motivated or establishing operation. So again, from the previous slide, name for setting it up purposefully so that it can be in a deprivation state, or making sure we're using items that are not satiated yet, is using motivating or establishing operations to our advantage. If an establishing operation is in place, it means that the deprivation is in place. It means that the stimulus, the reinforcement, will be more effective. We can manipulate deprivation and satiation to make our session run smoother by making sure that we don't provide too much of one type of reinforcer, or letting the parents know, as the analyst or specialist would, to not let them have access to certain items. Another way to remember establishing operation is that it makes the reinforcement more effective. So I want you to think about yourself. You have the ability, whenever you want to throw, well, at least think you do, to throw a heavy object through a window. Why don't you do it? Well, the establishing operation probably isn't in effect. You probably get arrested for it or something like that. But what if there was a fire in the room and the only way out was through the window? That makes the behavior of throwing a brick and gaining the reinforcement of the open window much more effective, right? Because the establishing operation is in effect. Likewise, you have the ability right now to open up an umbrella, to go pick up an umbrella and open it, but you probably don't. Unless it's raining outside, right? Because if it's raining outside, the establishing operation is in effect. It will make opening the umbrella, that behavior, more reinforcing. Likewise, if a child has not had their iPad all day long, that will be a much more effective reinforcer because they are in deprivation of it. But if they had had it for all day, for 10 hours before you got there, they are probably satiated. So, there are some questions to ask yourself when planning. When and where am I going to reinforce, ignore, and or prompt? When am I going to increase a demand? Do I have all the materials I need ready to go? Okay, now you know how to manipulate the antecedents and consequences of behavior. Well, at least you know some of the academic work behind it. Now let's talk about how we're going to do it here at Learning Arts. So again, when we're talking about manipulating the antecedents, that means we're setting up the environment to make the good behaviors more likely and the poor behaviors, the aberrant behaviors, less likely. And by manipulating the consequences, that means we're controlling what the person gets from it. We're giving positive reinforcement or negative reinforcement, just some sort of reinforcement when desired behaviors take place. And we're ignoring or using extinction on undesired behaviors or redirection. So again, in your field test, well, not really a field test, right? But in your field work, you'll become much more familiar with this, about how this will actually look. But for now, academically, at the very least, you know that antecedents are what occurs before the behavior, and consequences are what come after the behavior. And you can manipulate both. If you need help in understanding this, try to apply it to your life. Just think about manipulating antecedents. Let's say you want to lose weight, or you don't want to eat as much sugary food. What would you do? Well, you could put the cookies up on the shelf, make the response effort harder, get rid of all the cookies, maybe set up all the healthy food that you want in the fridge, make it easier to access. And then we also can control the consequences, right? So let's say you spend a week eating the good food. Now you can give yourself something good. Maybe like a manicure. Go out for a manicure. Or go out to the movies. Or allow yourself to buy that video game you've been waiting for. So, again, antecedents are what comes before the behavior, and consequences are what come after the behavior. So there are two basic styles of teaching that we're going to use here at Learning Arts. Discrete trial training and incidental teaching. Discrete trial training. This goes with C04. Implement discrete trial training procedures. That probably sounded weird. Implement discrete trial training procedures. C04. So, what is a discrete trial training? The trial has a discrete beginning, your demand or instruction, and a very discrete end, reinforcement or not reinforcement. The skill being taught is broken up into simplified steps and to build up to more complicated slowly, to build it to more complicated steps slowly. Usually run this at a table or some area that's a contrived area with minimal distractions. Trials are run back to back and rapidly, one after another. There are multiple programs at Learning Arts that you will use in a discrete trial format. So if I say, clap your hands, that's the instruction. The individual claps their hands, and I say, awesome job clapping your hands. The antecedent, the instruction. The trial, the discrete beginning, was me saying, clap your hands. The behavior, the person clapped their hands, and a discrete end, which was me saying, great job clapping your hands. That is one discrete trial. And because we can do this in such a fast action, we typically do run them back to back and rapidly one after the other. A discrete trial can be broken up into 3 parts. The SD, also known as discriminative stimulus, it's the technician's demand. The R, it's a child's response, or if you have to prompt them, to prompt. And they either get reinforced or they don't get reinforced. That's the R plus or R negative. They should look familiar to you as the ABC contingency. The antecedent is the SD, the technician's demand. The response is the behavior. And the reinforcement is where we get the consequence realm. And remember, as an RBT, you can control the A and the C. Your demand, also known as the SD. This stands for discriminative stimulus. It is basically any stimulus that is a signal that reinforcement is available. Any demand that you give for a task is an SD. The SD you use is different for every program you run. So let's harp on this a little bit. It is basically any stimulus that says, hey, if you do this, reinforcement will come. So it is basically any stimulus that is a signal that reinforcement is available. So if you go up to your favorite restaurant and it's just about closing time and you see the sign, the open sign, and it's still illuminated, that open sign is a stimulus that says, yes, reinforcement is still available. You can go in and get your favorite food. Likewise, if you're running a little bit late and the closed sign is either illuminated or the open sign is flipped over to say closed, that is a signal that reinforcement is not available. That would be called an S delta. Now we're not going to go that in depth into it, but the point is that an SD is basically any stimulus that a signal that reinforcement is available. So when you're driving and you see a green light, you know that driving through it, reinforcement is available that you'll get through. Notes on an SD. Don't give an SD if you can't ensure that the behavior will occur, either through prompting or redirection. For example, if I'm saying across the room, touch your hand, touch your hand, touch your hand, all that person is doing is learning how to ignore my voice. We need to make sure that we can pair the response with your voice, especially true for kids who are just acquisitioning or learning this. We have to be very careful with giving demands that you cannot prompt. We don't want to keep asking a person over and over again to do something, because all they are doing is learning how to ignore you. Basically, anytime that we give an instruction, we should either A, be able to follow through with a prompt or redirection, or if we can't prompt a behavior, such as like a verbal behavior, we're not going to keep saying it over and over again. We may try to change the establishing operation. We may make the reinforcement more desirable or whatnot, to have them basically ask for it. But the point is that we're not going to keep asking if it's something we can't prompt. So, For an SD, don't give an SD if you cannot ensure that the behavior will occur, or if it's something that you can't prompt and you can't really ensure that it's going to happen. Make sure not to just keep asking. Make sure to ask a couple times and then stop. Because otherwise, they're just learning to ignore you. Remember to manipulate the situation to put the odds in your favor. Sorry for tripping over my words there. Giving SDs. We're going to avoid using can you questions. If I said, can you touch your head? Well, it's a question, right? Can you touch your head? Well, yes or no. Okay, we're going to say touch your head. Okay? Because when we ask the can you question, you are giving the child or the individual the opportunity to say no. And you must respect that. Be very direct with your demands. You don't have to be harsh. You don't have to be overly assertive. But get that little bit of a command voice down. Develop an SD tone of voice. It should be different than your play voice. It basically says that you mean business right now and that you should attend. It's basically acting as a prompt for the individual for them to attend. It should be clear and easily heard. It should not be mean, but it can be stern. It can be somewhat assertive. Doesn't need to be overly assertive, but it can be assertive. The point is that it's basically a signal for them to attend. For example, in my life, I have a voice that when I use it, it's both a tone of voice and a body language thing. My kids know that I'm being very serious at that moment. But I do reserve it for those moments when I have to have them attend to me and basically cut out all distractions. So again, we want to develop that SD tone of voice, some sort of command voice. It should be different than your normal voice. This can take time, and nobody's saying this is going to happen overnight. So just practice it. Because remember, you are in control in the session. The child is not controlling you.